Liu is a clinical lecturer at the University of Alberta. Also, Dr. Liu is a community family medicine and acute care physician at the University of Alberta Hospital and is an influencer at the blog Life of Dr. Mom. A couple of reminders before we begin. We encourage you to turn on your cameras if you're able to. This session will be recorded and uploaded to our YouTube channel. Also, there will be a Q&A at the end of the session, and you can unmute at that time. Feel free to write your questions in the chat at any time, though, and we'll cover them during the Q&A. With that said, though, Dr. Liu, feel free to take it away.
Okay. Hi, guys. It makes me feel really cool that on a weekend, on Saturday, so many of you guys are here to chat with me and hear why I chose family medicine, I guess my journey into med school, why I chose medicine, and a little bit about me and my family. So I'm Stephanie Liu, I'm a family physician. I'm also now an assistant clinical professor at the University of Alberta. That's in Western Canada. And I'm founder of Life of Dr. Mom, a parenting blog, and by Dr. Mom, a company that makes children's products that are evidence-based. Okay, so a bit about me. I'm from Vancouver, British Columbia, so that's in the west coast of Canada. My parents, neither of them were in medicine, but they kind of really wanted me to go into med school. I wasn't really sure what I wanted to do. I would actually, you know what? I would say I was 70%. I knew I wanted to do something in science and healthcare. But along the way from, childhood through to university, there were a few things I tried out. I tried out research. I worked in a physical chemistry lab during my undergrad, and I really liked it. I wasn't really sure if that was for me. I ended up pursuing a master's in biochemistry at Columbia University, and that was a really enjoyable experience. But that was kind of what settled me in to say, I kind of want something more, I guess, direct patient interaction. So I then figured out research wasn't for me. Along the way, I also applied for dental school, and I think I would have been happy as a dentist. I really like that with dentistry, there's I would say a lot of fine motor skills that you get to fine tune. And I really enjoyed working with my hands. So that was one thing that I was interested in. But the one thing with dentistry that kind of, I guess, turned me off of that and made me kind of decide with medicine was that, with dentistry, you get to interact with patients, but not in the same way as a physician, family physician, my point of view. Other than the interaction when you first kind of speak to your patient as a dentist, the rest of the time, you're kind of just working on them. So that deterred me from dentistry. And then I think, as some of us might experience, there's also that bit of a pressure with family business too. My mom is in the finance industry, and for a very brief period in my life, I kind of thought that was a cool thing that I might be interested in. But in the end, I decided that research wasn't for me. Dentistry was super cool, but I didn't think that was going to be my thing in the end. And the family business, I was kind of afraid to work with my mom, afraid of too much conflict. So then I ended up in medical school at the University of Alberta. And during med school, I would say those of you that choose to go into medicine and get accepted into med school, for me at least, it was some of the best years of my life. I actually met my husband in med school, met the best friends of my life in med school that I still talk to on a regular basis now. So it was just probably the best 4 years of my life. I loved it. During med school, you're expected to kind of choose what type of specialty you want to do. I would say right off the bat, people can kind of figure out if they're more surgically oriented or if they're more medicine oriented. I kind of knew I was for sure more medicine oriented. So the two fields that interest me were internal medicine and dermatology. I love that in internal medicine, you look at the patient as a whole, all of their comorbidities, and you look at the body as systems, not just one specific body area, like my husband, ear, nose, and throat. You look at everything from the heart, the lungs, the GI system. You're just kind of looking at the patient holistically. And then the other area that I was really interested in was dermatology. I think dermatology is really cool. I love being able with dermat. It was really cool how your knowledge, you're able to do those spot diagnosis is really fast, and how a lot of medical conditions that manifest in the skin, that's how you identify it. So I thought that was another cool area. But in the end, I rotated in both of those. I did electives. I knew that family medicine was for me after more rotations. So I think family medicine is really cool, and I know it's the field for me. I love it. So happy that I ended up choosing family medicine. Family medicine chose me. One, because of the continuity of care. So I've been in practice for 7 years, and most of the patients are with me are from my first year of practice. And it's so cool, seeing a baby, that you first meet when they're 2 weeks old, grow all the way up into a 7-year-old girl or boy. And it's just so amazing over the years seeing them grow. I love that. Another thing that I really like is that, as a family physician, you just get to see all family members. You get to see the kids, you get to see the parents, you get to see the grandparents. And I think that's so cool. The other thing that touches on that is that diversity of practice. I do everything from pediatrics all the way to care of the elderly, to women's health. And I just love the diversity of practice. The other thing, as with all fields of medicine, is you get to be a lifelong learner. Every single day I'm learning something new, which is pretty cool to me. And the other thing that I really like is I have 2 kids, and I think that for family medicine, it really allows me to get flexibility. Right now, I work 5 days a week, but just half days. And I don't know if all fields of medicine are that flexible. Family medicine is great, especially if you're interested in having a family. But even if you're in other fields, there's other ways to work around that too. And I'm lucky in our clinic to have a licensed practical nurse and a registered nurse, and a pharmacist that works closely with us, and a dietitian. So I like that, family medicine, we get to work with a lot of allied healthcare professionals too. Family medicine has also, allowed me to pursue other passions that I have. One of them that I kind of touched on was my evidence-based parenting blog, Life of Dr. Mom. I think that it's really hard now for families to figure out what's credible information and what's wonky, possibly dangerous information. So what I did was I created a blog where I share my own experiences as a mom. And also the evidence. I summarize medical literature in an easy to read way. And it's just been so much fun getting to know my community, know people throughout the world. And it was obviously very rewarding to have my blog, featured in some larger news outlets. The other project that I recently started almost a year ago was kind of a spin-off of my Dr. Mom blog. I think that as a parent, it's also hard to find trusted brands that you trust. So what I did was I created a line of infant clothing and books that I think are educational and also functional, that can be beneficial to families. Right now, this is pretty informal. Like, can people ask questions if they want to, or should we save that till the end?
Usually we save it to the end, but whatever do you like to go with?
Okay, well, I guess we'll save it till the end. And then I have a case to share, but this one I want to be interactive. So can people just, if they, because I want to ask questions, and if they want to, they can, say what they think it is going on.
Definitely. I'll let you know what their responses are after each question.
Sounds good. Okay, so this is a patient that I think was my practice for 2 years. So this is a while ago. She's a 30-year-old female with one of the most common presentations in family medicine, fatigue. So she was saying, what, Dr. Liu, I just feel so tuckered out. I feel so tired. That's pretty much it. My appetite's normal. My sleep is good. I don't feel depressed. I just feel really, really tired. So we did labs, and one of the labs that came up on normal was something called a hemoglobin and ferritin. So do you guys know what anemia is? I'll look at Michael. Have you guys heard of anemia? Low blood counts?
We're gonna get on the responses here.
Yeah, you guys do? Okay, awesome. So anemia is a pretty common thing. That is a cause of fatigue. So her iron levels were low, and they were so low that it affected her body's ability to make hemoglobin. I'm trying to say it in a way that's like not the way I understand it, is like the molecule that's responsible for carrying oxygen around in our bodies. So that's why people get tired when they have low iron. So I said, you know what? Well, why does she have low iron? I asked about family history. I said, is there any family history of any types of cancers? She said, no. I said, any changes to your bowels or your bladder? She's like, no blood in the stool, No change in my bowels. I said, any new exposures? Have you been randomly eating lead? Lead can be a cause of weird anemias too. She said, nope, everything else is good. I said, have you noticed anything else changing in your diet? She said, no, nothing at all. But as a 30-year-old girl, the one thing that came up was she said, the one thing that I've noticed is that my periods are crazy heavy, 5-day history of bleeding a month and soaking a pad every hour. So that's considered something called menorrhagia, heavy menstrual periods. So I said, okay, I think this is the cause of your iron deficiency anemia. Okay, so what we did was we inserted a Mirena IUD. Mirena IUDs are used for birth control, but they're also used to lighten menstrual cycles. So some women get no vaginal bleeding during the menstrual cycle, and some will just get light spotting. So we did that, and we also started an iron supplement. And she said, she tried iron supplements for 2 months, and she said, iron supplements are kind of making me constipated, which is a common side effect. And I still feel really tired. So we actually set her up for IV iron infusion. So we set her up for IV iron infusion. And normally after IV iron infusion, the iron level should pop right back up. So we gave her the IV iron infusion actually 2 times because her iron levels were still low. So then I checked again in 3 months and she was still iron deficient. So this is messed up now. So I'm saying, okay, what is going on? We think we know the cause. She's got the heavy menstrual cycles. We followed up on that. She says, no, I'm not really bleeding that much anymore. We know that she was definitely getting iron because we did the IV iron infusion ×2, and she's still anemic. What do you guys want to do?
Any of the ones watching can unmute, but in the chat we have sickle cell disease.
Yeah, that's such a good thought. No, she didn't have sickle cell, and that is what we worked up to. Awesome idea.
Another person said not enough B12.
Yeah, that's true. That's definitely a possibility too. And that was negative. So I was kind of cheating there. So there's something called microcytic anemia, which is I think of them as like skinny red blood cells, and then there's something called macrocytic anemia. And she was in the skinny red blood cells, microcytic. But you're right, vitamin B12 deficiency can also cause anemia. So I'm super impressed with that. That's great.
No other response. Does anyone else have any suggestions?
No. You know what? That's pretty good though. I like to be pre-med and to still throw out some things are good. Thalassemia is a cause. We said, oh, could this be thalassemia? It wasn't.
One person suggested HIV or AIDS.
HIV or AIDS, yep, it could be, but you would see other cell lines down, other abnormalities in the blood work. Her blood work was pristine, other than this low iron.
One person asks, did she bruise easily?
Good thought. No. So they're thinking, could she have hemophilia? Could she be bleeding somewhere?
Vitamin C deficiency, folate.
Yeah, all of those are causes of iron deficiency anemia. Folate, even thyroid abnormalities can cause low iron. But what we found here with this patient was, so we knew it was an iron deficiency anemia. We initially thought it was her menstrual cycles that were the cause of the bleeding, but there's other causes of insidious bleeding. One of them being colon cancer. Okay, so the likelihood of her having colon cancer for someone at 30 years old, no family history, I pretty much thought it was absolutely impossible. But what I did was I actually repeated the history. One of the first things I do when I'm not sure what is going on is I essentially just sometimes repeat all the same questions I asked the first time I did 3 months ago. So when I repeated all the questions again, she said, you know what, I don't have any blood in my stool, but when I wipe, sometimes I see blood on the tissue paper. So I said, okay, well, that's something that's a little bit different. And I said, just back to the change in stool. When I say change in stool, people often think constipation. And she said, you know what, my stools have gotten a little bit looser and I think a little bit thinner. So what I did was I sent her off for a colonoscopy. Do you guys know what a colonoscopy is? Yeah. Okay. So colonoscopy is one of the screening tests, like the best screening test looking for colon cancer. So I shouldn't say screening test. It's an investigation looking for colon cancer or any type of other colon abnormality, like inflammatory bowel disease, things like that. And when they sent her for a colonoscopy, it came back showing a very small colon cancer, and she was actually, it was caught early enough. The cancer was located just to the colon. They didn't have to treat anywhere else, and it was able just to have it resected. So she did really well. She's fine now. She's got 2 kids. She's doing well, but this was a really good lesson for me because I think that this really nailed, and I'm so happy this happened early on my practice because it made me always make sure to follow up. So if I have a patient, they have an abnormality in their labs or something going on, I can't just say, okay, well, I'm going to give you the iron, peace out. Let's see you now that's fixed. Is to always follow up to make sure that things are improving. And the other thing was part of me wanted to, even when she just said, oh, my periods are a little bit lighter, just say, you know what, it's still because of the heavy menstrual cycles, she's still bleeding because of that. And if we really look at the case again, we knew that wasn't fitting, right? Because she already had the iron infusion. She now had what she was describing as lighter periods and a Mirena IUD. So sometimes I find that doctors, including myself, can get into trouble when we try to force to make a case fit. So you guys heard the term putting a square peg in a round hole. So even if the case doesn't really make sense, we're like, okay, no, it's for sure this, it's for sure this. And that's why I always try to keep my differential wide. So when this girl came back to me with a low iron and it wasn't getting better, I said, what else could this be? This was a very, very short talk. So let's just open up to questions. I love hearing questions. I like this to be interactive. And if any of you guys don't like asking questions out loud, I know I sometimes didn't, feel free to email me or contact me on social media through Life of Dr. Mom or by Dr. Mom.
I'm waiting for the questions to come in right now in the chat, but if anyone listening wants to unmute, you can feel free to do so and ask the question. We have one question here. Is it difficult to manage family/work life? Also, do you have a private practice?
Yeah, so great question. It is hard at times. I've got 2 kids, 4 and almost 2, and it's busy sometimes. It's hard sometimes turning your head off from work and not thinking about what's still going on at work. And then at the same time, sometimes when you're at work, you're thinking about the kids, and your husband and my partner. And what I found, one of the best things that I've done, especially during the pandemic, it's helped a lot, is really trying to compartmentalize. So I also find I'm more efficient when I'm focusing on one thing. So when I'm at work, I always have my phone available if our nanny needs to call us if we need help, if she needs something or if there's something wrong with the kids. But really when I'm at work, focusing on my patients and collaborating with my colleagues and allied staff. And then when I'm at home, I do my best just to focus on the here and now with them. It's hard, but I think I'm slowly getting better at it. But another thing I realized is I'm so fortunate as a physician that I have extra income to get all these extra supports. So we're really lucky to have an amazing full-time nanny that helps us. So when I'm running late at work, I come home and dinner is already half made. So it just makes things so much easier, and I just feel so lucky to have that situation.
Another question we have is, what was your most unexpected challenge with opening your practice and simultaneously starting your family?
Oh, good question. So in the US and Canada, I think that's slightly different. I know most a lot of physicians have their own private practice where they're the owner. I worked the first part of my career, I worked at the university, so I worked kind of more at a government facility, so I didn't have to manage any management stuff. And then over the past 4 years, I moved into practice that's outside of the university, but I'm not an owner. I don't own the practice. It's owned by another physician, and there's about 10 of us, and the other 9 physicians working there don't own any of the clinic, and we just pay a designated overhead to the clinic.
You mentioned a little about what you do. In this case, this first case, when you really can't figure out what the diagnosis is, you go through the history, kind of rework things once again. Are there any tactics that you use when you feel like you're stuck or can't figure out a diagnosis?
Yeah, I think in medicine, one of the good things is we have great colleagues, right? And when I feel like I don't know what I'm doing or I'm a little bit nervous, is I don't ever hesitate to call a friend or call a colleague or put in a referral to another subspecialist. And even with people in my practice, we call it like the open door policy. Like a lot of us, even when we're charting at the end of the day, we have our doors open. So if there's something that's bugging us or we just want to run this case by someone else, we just stop right by to our, we call ourselves neighbors, like to our colleague next door, and we just ask them, hey, what would you do in this case?
So what does your typical day look like working as a physician?
Yeah. So I guess let me just change the shape of this. So I'll tell when I first start. So pre-kids, my schedule would be I'd wake up, I'd have breakfast, go to clinic for 8, finish around 4:35, work out, go home, and then do it like all over again. Weekends, I used to work 6 days a week, a Saturday clinic too. Um, and then I would always, me and my husband would always take a month off every year. So this was when we pre-kids. So I would probably do like 50, 60 hours of work a week. Because the one thing with, I think, all fields of medicine is it's not just when you're seeing patients, it's the documenting afterwards too. So sometimes in the evenings, even after I get home, I would, catch up on a little bit of paperwork, figure out some billings, send some work lists. Now with kids, it's quite different. I would say I'm way more balanced now. So I wake up with the kids. We have breakfast together. Sometimes I just have a coffee. I take my daughter to preschool and my son to his little camp thing. I wait there for them for 2 hours. During those 2 hours, I catch up on my blog stuff. So I, respond to messages. I think up the content, and then I pick them up for around 11:30, 12. Drop them off with their nanny, and then I go to clinic. I start seeing patients from 1 o'clock to 4 o'clock. So when it's 3:30, 1 to 4, chart a little bit, and then I go home. We have dinner, we chill, and then I do that over again.
All right. Pretty long day, pretty tiring day, but I'm sure that's well worth it and rewarding.
No, it's
Is
pretty.
there any other rule that you learned only after having a specific experience?
Say that again, Michael.
Is there any other rule that you learned only after having a specific experience? Like, for example, you mentioned about the case here, where you learned to kind of go over things once more when you're not sure about the diagnosis. You learned really an important thing that you can apply in the future. Any other rules that you learned also along with that with specific experiences?
Yeah. Yeah. So I don't know if this is a rule, but one of the things that I find, like in all fields of whether you're a doctor or you work at the grocery store, or if you're a business person, is sometimes you interact with people that are really mean and quite rude. And I remember that earlier in my career, I'd get so mad, it would ruin the rest of my day when people were rude to me. And the one thing that has changed is one of my patients that was really, really rude, what people call like a difficult patient. I learned that she had a very horrible childhood and was abused. And what that helped me realize was people that are mean and angry, there's small subset of people that are just mean and angry, but a lot of them are mean and angry because something really shitty happened to them. And so I think that's another thing that's changed in my practice is after that patient, I realized, when someone is really aggressive with me or rude, it's not necessarily what I did. It's these experiences that they had in their life that made things really hard on them. And that's their way of talking about it. So I try, instead of going back at them with anger, is trying to be and it's hard. I'm not always good at this, but to be as compassionate as I can be.
Compassion is definitely a great and important part of being a doctor in general. In regards to the patient from the case and patients in general, how do you bring up sensitive diagnoses and treatments, such as the early stage colon cancer and even suggesting the IUD in your case that you just presented, which may not align with family plannings or views?
Yeah. Okay, that's a really good question. So, um, they actually teach you this in med school. I forget the acronym, but you have to make sure that the setting is the right place, and that you're, taking into the whole person as a whole, right? Like, especially like you mentioned with that patient, she already had one child at that point, before the IUD, so she was actually kind of happy to get the Mirena IUD because she was just using birth control before. But taking the patient all into consideration, right? Like realizing what their family planning goals are, what their history is. Do they have any trauma that they're experiencing? What their other life circumstances are. So first, like, I wish I remembered this acronym. I can't, but in general, what I do is I try to make sure it's the right setting. So whenever there's something that you want to tell someone that's hard, especially a cancer diagnosis, is I try to always do it in person. COVID's been a weird time, so sometimes I've had to have horrible conversations over the phone, but if you can, in person, and making sure that you're not rushed. So making sure that we have enough time to talk through things and that they feel like they can ask as many questions. Another thing that I think is important is always letting them know that the door is open and saying, what, more things are going to pop into your head. You can just take a few minutes to let this absorb, and you can call me, you can book another appointment, we could talk about this more. So making sure, I guess, one, the setting is right, that you're in person, you're in a quiet place where it's not like loud and distracted. Making sure that you give that person that they feel like they have enough time to ask all your questions, and let them know that the door is always open.
So what was the biggest obstacle that you faced in your career so far, and how did you overcome it?
What's funny? I feel like I'm doing a med school interview right now. It's good. I don't like all these questions. Okay, the biggest obstacle, is this career wise or like life family wise?
I think they're just referring to, they say in your career, so I think career-wise,
Career wise. Okay.
or if you want to expand it to family, or if you want to expand it to life, you can do that too.
I would say for career, you know what? I've had a pretty smooth sailing career, and I don't want to jinx it because when people always say, okay, yeah, it's been so smooth, and then obviously something really crazy happens. Okay, this is such a minor one, and I feel like this is such a baby situation, like not baby, but such a mild situation. When I first graduated, I mentioned I went and worked at the university hospital. And there it's, as with most Canadian healthcare is publicly funded. And you don't get to choose your assistant in at the university hospital. You're just kind of designated one. And so essentially, like, there's no boss or employee kind of situation. It's all they are regulated by a completely different body than we are. And long story short, I was getting bullied by my assistant, and I would have never, like, they don't teach you that in med school or residency, how to manage support staff. And it was a very difficult situation because what I always want, and this is, I don't know if any of you guys also are like that, but I'm a bit of a people pleaser. I want people to like me. And when they don't like me, it really upsets me. And my assistant, who I had to see every single day, definitely had a huge hate on for me. She didn't like me. She wouldn't room for me during lunch hour when I'd run late. When I'd run late, she'd get a little bit annoyed with me and irritated with me. And the biggest thing that I learned with that, through that experience, and I feel lucky, for this to be my biggest obstacle in my career, I feel so lucky, is I realized that, what, in medicine, in a career, as long as you're treating people fairly and that you're being nice and kind to people when you can, then that needs to be enough. Not everyone's going to like you. There's going to be some people that have a hate on for you, but as long as you know that you're being nice and fair to them, then that's just going to have to be enough. Because it was killing me that she hated me. But yeah, after that, that's just kind of one of the life lessons I learned, is be nice to everyone else. And as long as you can sleep with yourself, you can live with yourself and feel good about yourself with how you're treating others, and that just has to be enough.
You mentioned a little about how you discuss some cases with colleagues. How often do you work in teams with your colleagues to diagnose issues?
Yeah. So I would say earlier on in my career, I would probably ask a more experienced doc, like at least once a day, run through one case a day with a physician, or even just like quickly text my husband, oh, what do you think about this situation? But now I'm getting more and more like I've seen more and more cases where I feel more comfortable, but there's always, I'd say once or twice a week that I'd say, oh, am I on the right track? So I'd say once or twice a week, I would discuss a patient with my colleagues.
And to tag along with that, with the previous question, I know that there are grand rounds in the US to promote further discussion and education on patient cases. I'm also curious to know if this carries on to the Canadian educational system.
Yeah, we have grand rounds here too. It's really good. It's mainly more in the academic centers. But yeah, there's weekly, monthly grand rounds.
It's nice. So, have you been involved in any of them, and then what were your experiences with grand rounds?
Yeah, so earlier on in my career, I've presented a few grand rounds. And actually during the pandemic, I was supposed to give a grand rounds. We're talking about doing a talk on social media and patient education, but that one got a little bit kiboshed because it was right when the pandemic hit. I really enjoy it. I like attending talks. I like attending them. One, when they used to be in person, to see my old colleagues I don't get to see regularly. And I like learning. Like, I think that if you're interested in medicine, that's one of the things that you have to like, because things are changing constantly. Like, one of the PAP screening guidelines have changed dramatically, even from when I was in med school to residency till now. So I just think that there's so much to learn every day from being a healthcare provider. And that has to be something that you kind of enjoy, and you have to feel motivated to want to read and motivated to want to attend conferences and things like that.
Thinking back to what your experiences were, what experience or program are you most grateful for in medical school that you recommend to future physicians?
What program? Okay, so we had something called discovery learning. I think in the US, it's also called problem-based learning, where you get into small groups and you go through cases together. And what I really like about that situation is that you're discussing things, you're running through cases with colleagues too. And it also gives you an opportunity to see, where are my colleagues at? Where am I at? Where are some deficits in my knowledge? How can I get better? And it also, I think, was a great experience because it's a lot of camaraderie. Like, one of the best things that I liked about my medical training was getting to know people, making friends. These colleagues that that you learn with are then later the same people you consult, that you run cases by. And I think that that's really cool.
There's some differences with the Canadian and US medical system. In Canada, regarding training, how many years of residency is needed to specialize in family medicine? And do you know of any differences between the years of training for Canada and the US regarding medical education?
Yeah, I believe for both, because I was actually going to go to NYU medicine, 4 years for medical school. But the difference is, I think in the US, you guys have something called an intern year. We don't have that in Canada. So right after med school, you decide where you want to go for what specialty and where you want to go for residency. And then that first year, you're already in that specialty. So for family medicine, it's 2 years after med school.
About preventative medicine, how have you implemented aspects of preventative medicine into your family medicine practice?
Yeah, good question. So I yearly physicals have now become a bit controversial. Some people say that instead of booking a specific time every year, you should be doing it periodically, like throughout the year at times they see appropriate. But sometimes I find that I get a little bit forgetful with that. So at least like every year, every 6 months, I do check in with patients to talk about lifestyle things. So, are you exercising? What are you doing for that? What's your diet like? Do you smoke? How's your mood? Do you see the dentist ever? things that, come up. So I guess I do kind of do the periodic too when it's relevant, but every year I have a dedicated, appointment to make sure that everything's happening, that they're exercising regularly, not smoking, that alcohol is being consumed within like the recommendations, checking up on family history, and then also screening tests that are needed. So mammogram, colonoscopy, prostate exams, things like that.
So since making the decision that you will go into medicine, did you always plan to go into specifically family medicine, or was it sometime during medical school that you made the choice?
It was during med school that it was the choice. Like it felt like I knew I definitely didn't want to be a surgeon. My husband's a surgeon, he's an ENT surgeon, and I didn't like being in the OR. Like my feet kind of hurt. I sometimes get queasy, so I knew it wasn't for me. So I knew I wanted to do something in medicine. And as I shadowed more, and I had one preceptor, Carol Lee, she's retired now, and she really kind of nailed it home for why I want to do family medicine. She was in practice for 30 something years, and just a relationship that you develop over 30 years with these patients is amazing, right? Like I've only been in practice for 6 years, almost 7 years. And, patients are just so thoughtful. Like they, for one of my kids, one of my patients made this, she asked me, I didn't know why, she's like, what are your daughter's favorite animals? And I said, oh, she really likes kangaroos, she likes turtles. And I was like, I thought it was a very random question. And why she asked that was she knit a huge blanket, like this huge, with all of her favorite animals and her name on it. And I'm like, I can't imagine, well, I'm sure there's other fields, but I obviously think mine's the best, that you're able to really connect with your patients too and see them over the course of their time. And not just them, but their whole family.
So I guess you already addressed the next question I had. It was more about why did you pick specifically family medicine instead of when? Anything else you'd like to add to, past the bonding that you have with patients about why you chose family medicine?
Yeah, the flexibility is huge. Like I think that family medicine is so suitable for just, I guess, the career path I took on too. So I'm involved in medical education. I have learners with me a few times a month in clinic with me for developing their clinical skills, but also with me working part-time, it's really allowed me to, pursue my other passion, starting a business and also having like an evidence-based parenting blog. Um, the scheduling, I couldn't imagine. Some days are long and it feels a little crazy, like I'm jamming a lot in, but I can't imagine, any other field where it's so easy and it just feels so right to be able to start your own side hustle too.
Just another question that someone just suggested to tag along with your response. What other specialties do you recommend that have the same flexibility and continuity of care?
With every specialty, there's some continuity of care, like 100%. Even my husband is someone that's so subspecialized, ear, nose, and throat. They follow up cancer patients or patients with chronic rhinitis for a long time too. So they're in dermatology. I've got friends that are dermatologists, and they follow up their melanoma patients very regularly too. So they get to know them well too. I would say that as a surgeon, just seeing my husband's career, it is a lot more challenging to have a side hustle because you have more designated OR times, more specific being on call times. So you can do a side hustle in any field of medicine that you want to do it in. There's a lot of other subspecialists that have side hustles, but for me, I just think it's the best. It's essentially my dream schedule right now, being able to, take my kids to preschool and summer camp, being able to work those 2 hours while I'm there on a project that I really like, that's, developing my brain in a different way. And then get to drive them home. And then I get to see patients that I've been able to care for the past 7 years. Like right now, I'd probably say is the best work-life balance. Life sometimes gets a little crazy, but the best career balance that I could have imagined for.
So you touched a little on your private practice. How do you make the decision to go into private practice versus working in a hospital? And also, would you go to working in a hospital in the future?
That's such a good question. You know, with right now, I don't think I ever will because I love my clinic right now. I love all the support staff. Like we actually feel like a family. We have potlucks. Potlucks are back on now that numbers of cases of COVID are back on, and it feels like a family. Like we feel like friends. At least in the hospital setting I worked in. Um, I think that it might have just been a long shot where I was getting bullied by my assistant. Um, so I think with that past experience, I don't know if at least for the next few years if I'd want to go back there. I just really love my clinic right now. And I think you guys have probably found that too. Like sometimes you just find a group of people where it just fits, where you know your colleagues are right, the support staff are right. You know, even like at certain jobs, like you find your little niche. And I feel like I found my niche right now.
Mhm. What was your most impactful patient encounter?
Okay, so this is the hardest one right now because she's actually dying. So she's a palliative patient. She is 74 years old. Um, she never had children, always wanted children. Her husband passed away 10 years ago. I met her right at the beginning of my practice, and she like followed me from the other clinic to this clinic. And she is like one of the most kindest, nicest people. Like some of the visits might not even be for a specific medical issue, but she just wants, you know, to give me updates on her life. And you know, sometimes when she's going through hard times with some other family members, like we just talk about things quite a bit. And I've just followed her so regularly, and she is someone that is probably going to pass away in the next, I would say, somewhere between the past probably in the next 3 months. She has something called chronic obstructive pulmonary disease, so COPD. Hers was from smoking. 7 years ago when I first started, or just first started as my patient, I asked her to quit smoking. We tried everything we could. She couldn't smoke. So she's continuing to smoke. She's on home oxygen now. She can't leave the house. I do home visits for her. And the original question, Michael, was it was like, how has that changed your life, right?
What was the most impactful patient encounter? But I think that goes along in the same line.
Yeah. So she is my most impactful patient encounter because one, I think once you get to know someone, it kind of deepens that interaction too. So I feel like I know Norma well. I shouldn't have given her first name, but there's a million Normas in the world, so it's probably okay. Um, and she has shown me that there's so much more to being a good physician than just, you know, really managing her medical conditions and, you know, making sure that she's physically healthy. Because if that was the case, I would have been done doing a really shitty job because after 7 years, I couldn't get her to quit smoking. And now she's had advanced lung disease that's never going to get better. But it's how you treat people and developing that relationship where you're also caring for their mental health too. So even though this is not the outcome that I wanted for Norma 7 years earlier with her, you know, she'd smoke over almost 2 packs a day. I think that we have a really therapeutic relationship because there's been times that she suffered from depression, has not been able to get out of it, and that we were able to get out of it together. Um, so I think that the biggest thing that I learned about is, you know, especially as any type of physician, you can't just look at their physical well-being. You have to look at their mental health, how they're feeling emotionally, what other supports they have in their life. And I think that that's what's really my biggest take home from that patient interaction is not just being there for their physical issues, but also being there for their mental health too.
Yeah, and that again touches on compassion, like we mentioned earlier. A question that was not necessarily mentioned, but I personally have been wondering is about private practice. So I noticed that there are more specialties that are more oriented towards private practice than others, like for example, family medicine, internal medicine, whereas, and also dermatology, whereas other ones like more surgery oriented ones would not be as much oriented. And I think the main factor behind that is resources. When you're in private practice, you have to fund that yourself. Any other factors that you know of that would go into the frequency of private practice between one specialty and another?
Um, I think those are good ones, but also with private practice, the big thing that I think the question is whether you want to own your own clinic or work with, I guess, work for someone else. I hate that term, work for someone else, is whether or not like you like business and you like managing people. I know for myself, I would rather focus, specifically on the patients and on my side hustle. And I don't want to have to worry about, figuring out, are we out of gloves? Do we need to, change the hospital beds? What is our autoclave working? Like, I don't even want to worry about things like that. But there's some people that like to be in the nitty gritty of everyday practice, and they like being the ones that are choosing the support staff. For me, I just want someone else to choose the support staff and for me to focus on the patients and getting along with them and for things to be run smoothly for me.
One more question. So you mentioned that you have a blog. How do you view your blog? Is it something that you like to unwind with? Is it something that you just have as an enjoyable hobby? How do you view it, and how does it help you maintain a good lifestyle, a well-rounded lifestyle?
Yeah. So initially, when I started, my husband was doing a fellowship at Emory, and I would have 4 weeks off at a time. And my daughter was napping so well in the afternoon, so I was kind of bored. And I like, I like writing. I like scrolling on the internet. Like, I think it's kind of fun. I like looking at pictures. So I said, you know what? I want to make. Have you guys heard of Goop, like Gwyneth Paltrow's like little blog? So that's definitely not evidence-based. Some of the information there is potentially harmful. And I said, I want to make a cool website, cool like account that has got good pictures, where I share, fun things. But at the same time, I want to educate. Like, I want to make something that people actually want to read and where they want to, get trusted, credible information. So I started it like that. And it was just a passion project. It was really fun. But over the past, I'd say a year into it, I became the Pampers Canada health expert, and I also work, for CeraVe and some other product lines too. And so I would say the reason I started and my passion for it's the same. I want to educate the public in a way that's fun and relatable and educational. But now it's become, I guess, more of a business too. So goals are the same, but I guess there's also, I get a little bit more benefit financially too from it.
Well, I think that wraps up our session for today. We're nearing the end of our time. Thank you so much, Dr. Liu, for taking time out of your busy schedule to enjoy us. This was really an enjoyable session. We're great to have you over. For our audience, to receive a certificate for this session, you must pass the quiz on our website. It's going to be under the July conference page, under the schedule there, which is now uploaded, and you can access it. Be sure to join us for our next virtual chatting session with Dr. Eltis, starting at 4 p.m. Central. And once again, thank you, Dr. Liu.
Awesome. Thank you guys for having me.
Thank you, Dr. Liu.
Bye.
Welcome to the pre-med session today with Dr. Eltis. My name is Michael, and I'll be today's host. Dr. Eltis is a lecturer in optometry at the University of Waterloo, recognized for excellence in glaucoma. Dr. Eltis is one of only 3 diplomats of the American Board of Optometry in Canada. He has also both presented in and published in publications all over the